Hello and welcome to the Obstetrician's View. Today we are talking about a very common but often misunderstood condition, uterine fibroids. If you've ever had heavy periods, pelvic pain, or you've been told during a scan that you have fibroids, this video is for you. Fibroids affect up to 70 to 80% of women by the age of 50, African descent being a risk factor. Yet many people don't fully understand what they are, when to worry, or what to do about them. In this video, we will cover what uterine fibroids are, what causes them, what are the symptoms to watch out for, how they affect fertility and pregnancy, and then treatment options that are available for their management. So let's get into it. What are uterine fibroids? Uterine fibroids, also called leiomyomas, are non-cancerous growths that develop from the muscle layer of the uterus. They are benign, meaning they are not cancers, and in most cases they do not turn into cancers. Fibroid can vary widely in size. They could be as small as a seed or as large as watermelon or even more. And a woman can have one fibroid or multiple fibroids at the same time. There are different types of fibroid depending on where they are located within the uterus, that's the womb. Fibroids are classified as either intramural fibroids, that's when they are in the muscle layer within the walls of the uterus. These are the most common. They could also be called submucous fibroids when they project into the uterine cavity. That's the part of the uterus where the baby actually develops. Then they could be subserosal fibroids projecting outside the uterus. They could also be pedunculated fibroids when they are attached by a stalk to the uterus. Each of these types of fibroid can cause different symptoms depending on where they are located in the uterus. So exactly what causes this fibroid, the exact cause of fibroid is not completely understood, but several factors have been known to play a role in the development of fibroids. One is hormones. Fibroids are hormone sensitive. Estrogens and progesterone have been known to promote their growth. They often grow during the reproductive years. They shrink after menopause. The next is genetics. If your mother or sister has fibroid, your risk of developing fibroid is higher because they have been shown to have some genetic linkages. Another risk factor is race. Fibroids are more common and often more severe in women of African descent. Lifestyle factors like obesity have also been known to be associated with the development of uterine fibroids. So what are the symptoms of uterine fibroid? Many women with uterine fibroids have no symptoms at all. Some of them only get to know when they go to do an ultrasound scan for another complaint or another symptom. But when symptoms do occur, they may include heavy menstrual bleeding, especially when the uterine fibroid is located in the uterine cavity, prolonged periods, passing of large clots, and then all of these can lead to anemia. There could also be pelvic pain or pressure with a feeling of heaviness in the lower abdominal region. There could be abdominal swelling, and some women look pregnant due to large fibroids. There may be frequent urination when the fibroid is pressing on the bladder. There could be constipation when there is pressure on the rectum, pain during sexual intercourse, sometimes infertility or difficulty with conceiving. So what are some red flags about uterine fibroids you should know? So you should seek medical attention if you notice any of these. You have very heavy bleeding that soaks your pad hourly or even less frequently, if there is severe pain or rapid increase in abdominal size. Any of these should be a red flag for which you should seek medical attention. So let's talk about Fibroid and fertility. Fibroids have not been documented as causes of infertility. And this is because many women who have uterine fibroids have been known to conceive, carry their pregnancies to term, and deliver their babies. However, in some cases, women who were evaluated for infertility and no abnormality was detected except uterine fibroids, following myomectomy, that is removal of the uterine fibroids, some women have been reported to conceive. So in instances where the fibroid blocks the fallopian tube or distorts the uterine cavity or prevents implantation of a fertilized ovum or increases the risk of miscarriage, in these instances, yes, fibroid can affect fertility. Submucosal fibroids are the most strongly linked with infertility, and of course the reasons are obvious because they lie within the cavity of the uterus, competing with the baby for space. However, many women with uterine fibroids have healthy pregnancies. So let's talk about fibroids in pregnancy. During pregnancy, fibroids may increase in size due to the effect of hormones. They may cause pain of varied severities due to what is known as red degeneration, which is common in pregnancies with coexisting fibroid. They may also increase the risk of preterm labor and affect the baby's position and development. But many women with uterine fibroids still have normal pregnancies, like we had said earlier. Fibroids are usually diagnosed through ultrasound scan, which are the most common means of diagnosis. They may also be identified during a pelvic examination during a visit to the hospital. MRIs also in very rare cases. So what are the treatment options for uterine fibroids? Treatments of uterine fibroids depends on the symptom, the size and location of the fibroid, the age of the woman, and her desire for future fertility. In many cases, it may just be watchful waiting. If there are no symptoms and the sizes are so small, no treatment may be needed. However, it's worthy of note that fibroids will grow over the years. Some medications can also be given, like pain relief if the woman has pain associated with the uterine fibroids, or drugs to reduce bleeding if there is associated heavy menstrual bleeding. Hormone therapies can also be given to shrink the fibroid in selected cases. But note that this does not cure the fibroid. Neither does it make it possible for you to excrete it or urinate it, as is often said. Some non-surgical procedures can also be done, and then surgeries can be done, like myomectomy, which is the removal of fibroids. This is done to preserve the uterus and is preferred for women who want to have children. Hysterectomy can also be done, which is the removal of the entire womb, and this is the permanent solution for uterine fibroids. But in this case, there will be no future pregnancies. The woman cannot get pregnant anymore. So let's clear some myths about uterine fibroids. They are not caused by spiritual attacks. They are not always cancerous, and some women can still get pregnant with uterine fibroids, especially if they are very small. Also know that while fibroids cannot always be prevented, you can reduce your risks by maintaining a healthy weight, have a regular medical checkup so that they are identified early and can be managed. Uterine fibroids are common, manageable, and often not dangerous. The key is early detection and proper medical guidance and counsel. If you found this video helpful, don't forget to like, share, and subscribe to the Obstetrician's View for more clear and reliable women's health information. I'll see you in the next video.